The Cleveland Clinic Foundation is admired all over the world. I'm sitting here now with the CEO of the Cleveland Clinic Foundation, Dr. Toby Congrove. Welcome.
Well, thank you very much for having me.
Well, it's great to see you. And as I said, everyone looks to the Cleveland Clinics as a real example of what is being done right. And you've said that, you know, in order to teach people on how to do things right, you put people on the ground. Is that right?
Well, what we've done is we've spread the Cleveland Clinic in various locations. Increasingly, we now have a facility in Las Vegas, a place in Toronto, 2 facilities in Florida, and a very big presence in Abu Dhabi in the United Arab Emirates. And we've learned very much like law firms and accounting firms and consulting firms, in order to put your DNA there, you have to put some of your people there. So we've taken some of our very best people and asked them to go to these locations and to run it and put our people and our ideas and our culture there.
And can you really tell me what you're doing differently than maybe other health systems that are already on the ground?
Yeah, we're a very different kind of an organization. We are a group of doctors. We're a healthcare group, medical practice, that has facilities. We're not a hospital that employs doctors. So essentially it is a doctor-driven, doctor-led organization, and we decide what we're going to do, where we're going to go, how we're going to balance our budget. All those things we regulate ourselves. So we in the Mayo Clinic and a few others have that model, but it's a very distinct model, and the difference is really fairly subtle, that we're not working for a hospital. The docs are the organization.
Okay, and also you're very selective on the kinds of people who will work for the organization.
Well, I think it probably works 2 ways. I mean, a lot of people don't want to work for us. They don't want to be they want to be independent. We think that medicine has now gone from a solo sport to a team sport, and that healthcare is way too complicated for one individual to embody all the knowledge that is required, and so it takes a team of people to bring their expertise and their knowledge to get optimal care for the patient. So it's a major coordination, and not everybody wants to do that.
Okay. We were speaking earlier about how the people you hire, you pay real close attention to what they are in their personal lives. For instance, you won't hire a smoker. You will test for that at the interview. Tell me a little bit more about that.
Well, you know, one of the things that we, when we looked at, we said, look, we are a healthcare organization. Well, we're not just there to take care of people when they're sick. We ought to be trying to promote health and keeping people well. And we can't do this unless we walk the talk. We can't say, you shouldn't smoke, and then light up a cigarette. So we said, why don't we as an organization begin to model what is the appropriate health care and how you take care of yourself. So we decided, first of all, we wouldn't let anybody smoke on any of our properties, parking garage, lawns, etc. We said, then we're going to give major free smoking cessation to the community in which we live. And then we said we're going to stop hiring smokers. And so we test for people when they come in for drugs, and we also test for nicotine. And if they test positive, we say, well, we'll give you a smoking cessation, and you can come back and take the exam again in the future, but for now we won't hire, and that includes doctors and nurses and everybody that works at the institution. And it's interesting that it is a lot of people come up and thank me about for the environment and thank me for helping them stop smoking, and so it's rubbed over onto the community. Smoking in Cuyahoga County, where we are, has gone from 28% to 15% over a 6-year period of time. So you can make a difference.
Yes, and after initially balking at this, people really did come and see that it was quite bold and a great idea.
Yeah, and people are beginning to catch on to this. In your home state of Massachusetts, we're having inquiries from Massachusetts General. They're interested in doing something like this. Other organizations are beginning to think about whether they do these sorts of things or not. And ultimately, we have to keep the American public healthier. We can't just let them make themselves sick and then expect to take care of them and have it not the health care bill is going to continue to go up.
Are there other bold initiatives you have planned on the horizon?
Well, the other thing that we did is we then moved into, started to talk about the obesity problem. Obesity problem is very difficult and very complicated. first of all, we said we got to offer our patients and our employees appropriate food. So we made 40 changes in our cafeteria. I personally wheeled the fryers out. We took the trans fats out of the food. We took the sugared drinks and candy bars out of the vending machines. And then we said not only we give the good food, but we'll also encourage people to exercise. So we offered all of our employees free curves, free Weight Watchers, free access to our gym, free yoga, walking courses, pedometers, and that has now helped us lose 200,000 pounds.
Wow, collectively, yeah.
That's a start.
It certainly sounds like a strong one.
But we still have a long ways to go.
Is that what you recommend for other big institutions like yours, to give away things like this?
Well, I think we have to do two things. We first made all these things available for people, and then we said, you know, there's carrots and there's sticks. And so what we said was, you know, we want you to be healthy, and you can come and we'll offer you a physical every year. And if you don't have any chronic diseases and your weight's normal, then we will not increase your health care premium. Mm-hmm. If you're sick, you got diabetes or cholesterol or hypertension or obesity or smoking, then we want to have you enter into a disease management program. Mm-hmm. And if you do that, then we won't raise your health care premiums. So that's been the carrot that's helped people, and the financial incentives that's helped people. And we've seen now the participation in getting yourself back to health soar from about 13% or thereabouts within the disease management to now over 50%. And we expect it's going to continue to go up.
You're a familiar face in Washington. Lots of people who are big decision makers are interested in what you have to say, what you have done. Are you seeing that other states will start to move in this direction as well? Is that what they're interested in knowing from you?
Well, you know, I think all of us are on a journey trying to do a couple things. First of all, reduce the cost of health care by making it this delivery systems more efficient. Mm-hmm. And then secondly, reduce the burden of disease. We talked a little bit about reducing the burden of disease. Now I think what we're really looking at is how we can actually make the delivery of health care more efficient. We have to remember, for example, that hospitals really aren't organized generally around patients. They're organized around doctors. Mm-hmm. And why do we have hospitals? Well, the only reason I can see is for patients. And so we reorganized our facilities around patients, and we said, let's organize around patient organ system that's sick, their heart, their kidneys, their lungs, whatever. And so we'll take all the doctors who have either medical or surgical expertise around the heart and put them in the Heart and Vascular Institute. We'll take all the people who have expertise in the urinary system, nephrologists, urologists, and dialysis, and put them in the Urologic Institute. And then we'll do the same thing. So we took away just the departments of surgery and the departments of medicine, the way hospitals are normally organized, and organized around patients' problems. Now, isn't that a novel idea, organizing hospitals around patients?
Seems like the right way to go, for sure.
Yeah, well, we think it is.
All right. Well, Dr. Congrove, thanks for your time today. Appreciate it.
Pleasure.
I'm Mabel Jong. You're watching continuing coverage of the World Healthcare Congress in Washington, D.C.